Hey everyone, my name is Rowana and I am a nursing student at the University of Sydney here in Australia, and today I wanted to do a bit of a story time video about my first experience in an operating theatre as a nursing student on clinical placement. So at the moment I'm currently doing a clinical placement in a hospital here in Sydney that has basically it's like a surgical ward that I'm on. So I'm mostly just on the ward, taking care of patients who have either just come back from surgery or are about to go to surgery. And so that's pretty much what this placement is about. However, the other day I was able to go for the morning to watch a few surgeries, and I just wanted to share with you how it felt, what I saw, and do a bit of a story time about what goes on in an operating theatre, how people prepare for it, that sort of thing. So yeah, I just wanted to show you guys a bit of an insight into what it's like seeing that for the very first time. So I haven't really prepared anything for this video. I just kind of wanted to talk from the top of my head. So if I get a little bit lost or if things don't make sense or something, then I'm really sorry. To get started, I might just tell you a bit of an overview of that day. So the day before, my facilitator had told me that she was going to try and see if I could get into the surgeries the next morning, and she even said that it might be possible to see a C-section and the delivery of a baby, and I was, oh my god, I was so excited. That whole night I was hoping and praying that would be it would be a C-section. So yeah, anyway. So that whole night I was waiting to see if it was actually going to be the case that I could go and watch some surgeries, and the next morning she came up to the ward and said yes, we were going to go down at 9 o'clock and go see a few surgeries. So the ward that I'm currently on is a general surgery ward, but it also has a lot of colorectal, gynecology and some urology things as well. So when I went to go down into the surgeries, I got to watch the surgeries that would be going into the ward that I was actually working in as well. So it was kind of nice to have a continuity of seeing the patient go through the surgery and then coming back to the ward later that day and seeing those patients and taking care of those patients in the ward setting as well. So yeah, I really enjoyed that part. I didn't get to see the C-section, unfortunately, but I mean, I'm sure I will see one in the future. And a couple of other students that I'm doing placement with actually got to see a couple of C-sections, which is just amazing. And they were telling me about it, and I think they cried more than the parents did, so. Alright, so basically we went down, I had to get changed out of my uniform and put on some surgical scrubs, and this is basically for infection control. So you go into a change room and they have a whole wall full of surgical scrubs that are in different sizes, and you have to wear those when you go into the operating rooms. You can't wear your own clothes. You don't want to bring pathogens and diseases and that sort of thing into a very sterile environment where you're basically cutting someone open. So yeah, we go in, get changed. I have to keep my badge on me at all times, so I had that attached to me. I brought a pen just in case I wanted to write something down, which I didn't actually do any of that. And then we walked straight into the operating theatres. So I got taken through, and I'll basically go through the different people that are in the room at any one time. But I got greeted by the scrub and scout nurse, and they were just setting up for the first surgery. So I got to see 3 surgeries while I was there. The first was a mastectomy, and then I saw a colonoscopy, and the third one was a right inguinal hernia repair, which was actually done laparoscopically. So that's basically where they call it keyhole surgery. So if you've ever heard of keyhole surgery, that's what it is. You have a scope that goes through, a little camera that gets inserted, and then you have these long, it's kind of like these tweezer things that go through as well. And the surgeon operates them outside of the body and looks at what's going on inside through the camera. So it's all done remotely, which is kind of cool. So I got to see that as well. So I'm gonna go through kind of who's in the operating theatre, what happens, the whole patient journey, and what I got to see at the time as well. So the first thing I see is I walk in, the first patient is already prepped and under anaesthesia, so I didn't get to see that part for the first surgery. So the patient has been already prepared by the anaesthetist, and they've already gone under, they're lying on the table, and the nurses have obviously prepared them so that they're in the correct position. And when I had gone in, the surgeons were just gowning up, and the scrub nurse was getting everything laid out and prepared. So beforehand, basically there's a scrub nurse who scrubs in. She's wearing all the gown and sterile gloves and everything, is able to touch everything in the sterile field. And then there's a scout nurse who is documenting everything, getting any other equipment that the surgeon or the nurse might need in the during the surgery, and they can't touch the sterile field, they're touching everything else basically. There's also the surgeon, maybe an assistant surgeon, or maybe two surgeons depending on what's going on. You might have an intern or a medical student or a resident or someone else there. You might have another doctor as well observing or assisting on something like that in the surgery. And then what I also got to see was an anesthetist who is basically monitoring everything else about the patient, making sure the patient is breathing properly, his heart's working, everything's just working normally and is alive basically, especially under anesthetic, and making sure that all of that medication, the anesthetic medication, is properly administered and in the correct dosage as well. So, yeah. Alongside the anesthetist, there was also an anesthetic nurse, and she was basically there making sure the patient was in a good position, again, monitoring the patient, all their vital signs, keeping an eye on the patient, regardless of what is happening through the surgery. So they're there to make sure that the patient is in a correct position. They're preventing pressure injuries, because if the patient's sitting there lying on a table for a very long time and can't feel if something's going numb, like their arm's going to sleep or something, you know, when you get pins and needles, that nurse is there to make sure that they're in the correct position and they're not going to have any of those issues and then wake up and then have a dead arm or something like that as well. Obviously there's a lot of other things that they're doing, but I just want to give you a bit of a top-down overview of what I got to see. So yeah, the first surgery was a mastectomy, so I got to walk in and see the patient there. They had prepped the site, so what they do is they cover the patient in sterile sheets, and then the only part of the patient that's visible is actually the sterile field, or the part of the patient that is actually being operated on. So in this case it was breast tissue, because the surgeons were removing part of the breast as a mastectomy, and also sending a lump off for biopsy as well. I thought that it was really amazing to see how well everyone worked together. Everyone's talking to each other, asking questions, and also making sure that everyone else is okay, and just checking on everyone as well, which I thought was really cool. So scrub and scout nurse were talking to each other pretty much non-stop, making sure that they had everything that was needed for the surgery. And there were 3 surgeons for that surgery in total, and they were really cool. And what I didn't realize would be the case is everyone's really lighthearted, and you think going to surgery you have to be really serious, which it is quite a serious procedure obviously, but the surgeons would play music in the background to get everyone in the mood. Maybe it helps concentration as well, and also because there was an intern there, or a student, he was wanting to learn about the surgery as well. So the 2 other surgeons that were there were actually giving him a lesson basically. They were also teaching him how they were doing the procedure, what they were doing at the same time, and getting him involved as well. So that was cool to see. I wanted to mention that how I felt about being in an OR. So a lot of people may think that for the very first time that a student goes into an OR that they might feel faint or sick or something, because it's the first time seeing a human cut open. And yes, this was the very first time that I had seen a human undergo a surgical procedure under anesthetic, and quite a lengthy and big procedure. But I have in the past watched surgeries previously in person, because my mum is a veterinary surgeon. So she operates on small animals, so dogs and cats, and is a specialist surgeon in the veterinary industry. And I've been able to watch her do surgeries previously since a very young age. So I didn't feel queasy at all, because I have seen all of that stuff before. What I did feel was so much excitement and oh my god, this is the coolest thing ever. Especially because yes, I've seen surgeries before, but I'd never seen it on an actual human being, and I just thought it was it's a lot bigger obviously than a small animal. Yeah, I thought it was amazing to just watch how well the teams work together, and the atmosphere that everyone's in, and watching the scrub and scout nurse work together was really cool. So the first experience that I had actually made me feel maybe it's something that I'd want to go into, because I originally wanted to think about becoming a midwife, and I still really want to become a midwife. But at the same time, I'm trying to keep my options open, because I don't know what I'll enjoy. And this is what, for me, clinical placements is about. It's about getting involved, seeing what I do like, what I don't like, and having an understanding of where I want to be in the future. So yeah, that's what I really enjoyed about this particular day, which is awesome. Anyway, back to what happened during the surgery. So that was the first surgery, a mastectomy. What I then got to do post-surgery was follow the patient with one of the nurses to go and hand them over into recovery. So what happens is the patient has their surgery, they start waking up, the anesthetic nurse and the anaesthetist will wake them up and extubate them, which basically is taking out the tube that's helping them breathe. And there's a whole bunch of criteria that needs to be met before they can take that tube out so that they can breathe on their own. The anaesthetist then goes with the patient to recovery, does a handover with regards to the anesthetic and especially like the breathing capabilities of the patient. The scrub or scout nurse, whoever is available, will go through and do a handover of the rest of the patient's notes, so like the procedure that was involved, making sure they have the correct patient, so doing all of the checks like that. And that gets handed over into the recovery nurse, who is basically taking care of the patient while they recover post-anesthetic. So I got to go with one of the nurses and do the handover with them, so that was really interesting to see. And as you're doing the handover, the patient is like starting to wake up and it's like looking around and like, or they're like really tired and dopey, and like, it's a really weird experience. And I remember I've had surgeries before, and I remember being in that situation, like waking up, not knowing how much time has passed, and like you're in pain and you have no idea what's going on, and just like kind of, it's a bit disorientating. So yeah, that was really interesting to see, like the handover process. And basically, if you're working in the OR, you do the handover and you're straight back in prepping for the next surgery because it's so quick. I think like one of the analogies that I thought of when I was watching like the whole process was, you know, when you see like in the car races and the cars like go into the pit stop and they're like doing all the changeover, like adding fuel, changing the tires, that sort of thing. It kind of felt like that, like everything was so quick. One patient is taken out to recovery, and during that time everyone's like all hands on deck and scrubbing everything down, cleaning everything, getting all the new equipment in, setting up the sterile field, and that's all happening so fast. Yeah, it was really cool. While that is all happening, there is the next patient on the list who is basically getting prepped for surgery. So all before this is happening, the patient has to go through a pre-surgical checklist, which is one of the nurse's jobs. So one of the pre-op nurses, they will be going through that checklist with the patient, making sure that they haven't eaten anything for like 6 hours, I think it is, up to 6 hours before the surgery, and can't drink any clear fluids 2 hours before the surgery. So it's just like checking those sorts of things, making sure the patient has gone to the toilet, making sure that they've signed all of the correct documentation and they're aware of what's going on with the surgery, that kind of stuff. Then they go into like a holding bay. The holding bay is like right next to the OR theatre as well. And that's where the anaesthetist will come in and get them prepped with their medications. And I'm guessing like this is where they start to like prepare them for the actual anesthetic. I also noticed that one of the surgeons who, like the primary surgeon who's taking care of this patient, and doing the procedure as well, he or she will go into that holding room and have a chat to the patient, see how they're going, explain what the surgery is going to be again, just so that everyone is aware, and then they bring them through into the actual operating theatre. So yeah, and then the anaesthetist will then induce them into the general anesthesia or whatever they're needing for that procedure, and then the patient is asleep. Once the patient is asleep, the surgeons and all the staff in the OR will do what's called a timeout, and the timeout is to do a final check before the procedure starts to make sure that it's the correct patient, the correct procedure, the correct surgical site, so making sure that it's the right arm or leg or whatever it is that they're operating on. And yeah, just basically making sure that everything is ticked off that's required prior to the surgery before getting ahead with everything. And yeah, that's kind of how that procedure works. Two of the other surgeries that I got to watch was a colonoscopy. So the colonoscopy it's not a sterile procedure, so there's no like sterile field, but it's just a clean procedure. So everything has to be obviously very clean, but it doesn't have to be sterile. So you don't have to have like all of the sterile field and that sort of stuff happening, and you don't have to wear a mask either. The third procedure that I got to see was the laparoscopic inguinal hernia repair, which was really cool. So because there's a scope going down, and as well with the colonoscopy, they have all of these like TVs around the room, and obviously the surgeon who's performing the procedure has one in front of him, and he's kind of looking at that while he's doing the procedure. But they also have like little screens everywhere, and big screens everywhere, so that you can kind of watch what's going on, and the other nurses or whoever else is in the room can see what's going on as well. And that was really cool to watch. Like, and I remember thinking to myself, thank God I have a mask on, because my jaw was like, had dropped the whole time. I was just like, oh my gosh, this is like the coolest thing ever. Like being able to perform surgery on someone using like these little tweezer things, like, and a camera, like it was just so cool to see. Yeah, it was amazing, and I really, really hope that I get to watch some surgeries again, and a C-section if I can. I think I'm just so happy that I got to be able to see surgeries, especially because in this placement, this is like mostly a surgical ward placement, so I wasn't sure if I'd actually go and watch some surgery, so I was so glad that I was able to do that. Oh, I'm so sorry, my camera battery just died and I just replaced it, so hopefully nothing has changed too much. So yeah, I'm just kind of wanting to wrap up this video to just say, like, this was the most awesome experience that I've had this year so far with my nursing journey. If you're new to this channel, basically I am in my first year of my master's course, so it's a 2-year registered nurse program. So at the end of the 2 years, I become a registered nurse, and then I get to go into a new grad year as well. So I think this experience has made me consider maybe going down the surgical nursing pathway, maybe for a new grad position, because I know that there are some, especially in some private hospitals, there are some new grad positions that go directly into surgical nursing. So that would be really interesting. But one of the things that I really, really want to do is actually become a midwife, which involves some extra study at uni as well. So yeah, I'm still deciding, obviously. I just want to keep my options open because I really just want to make sure that I'm making the right decision. Anyway, if you like this video, then please give it a thumbs up, and if you want to see more from me and more of my channel, then please click the subscribe button down below. If you have any other questions about surgery or my experience in the surgery on the surgical ward or clinical placements or nursing in general, then yeah, definitely leave me a comment down below, and I will see you guys in the next video. Bye!